Hello friends, welcome back to my channel. So today in this ophthalmology playlist, we'll be discussing with the disease of the lens. So lens is an anatomical part of the eye. It is a crystalline lens. It is a transparent lens when we are born, but as the age progresses, it goes cloudy and becomes turns into a cloudy mass of tissue that is we known as cataract. So we'll be discussing within this video all the things that are related with the diseases of the lens. So first we'll be discussing about the cataract, its definition, its classification, its stages and clinical feature. Then we'll be coming with the senile immature cataract. Then what is a cortical cataract? Then comes to the congenital cataract. Then what are the post-operative complication of a cataract surgery? Then what is an hyphema? Its definition, it causes, its clinical features, and how will you treat an hyphema? Then comes to the what is the crystalline lens. It's anatomical part. So I will be telling this thing before only, and afterwards also I will be telling with the anatomy and physiology of the crystalline lens. Then comes with the phacoemulsification. We will study further with the phacoemulsification. And what are the types of extracapsular cataract extraction? What is this exactly extracapsular cataract extraction that we use during the cataract surgery? So let me talk about the lens right now. So lens is a crystalline, it is a crystalline transparent lens. It is basically made up of an epithelial cell which mainly covered by a capsule. Externally it is covered by a capsule. Inside that it is lined by a capsule by epithelial cells that are mainly known to produce a lot of collagen like fibers, okay, that makes the main stroma of the lens. So lens consists of the lens is like a pear shape. This shape will be the shape of the lens. It has an outer thing, it is called as capsule, and the outer part then next will be coming with the cortex, and in interior will be the nucleus. So the cortex is lined by the epithelial cell, while the nucleus is formed by the nucleus. Collagen or fibrinous materials are there which constitute the entire stroma of the lens. So what does lens does? The lens forms the 30% or 40% of the focusing power of the eye, the light. So it focuses the light over the retina. What is the retina? It is a light sensitive area of the eye wherein which the light is converted into electrical energy. The electrical energy then transferred to the brain. Okay, by because it consists of rods and cones which are biological transducers. Okay, this will be studying when we are discussing the retina. Okay, so meanwhile right now you understand what is the lens. Lens is a crystalline material. It is a crystalline material. It is flexible in nature. Okay, it is formed, it consists of an outer capsule. Then comes its the cortex. The cortex, it is lined by the epithelial cells layer, and inside that it consists of the nucleus, which is consists of lot of collagen fibers. Okay, so now let us discuss with the cataract. So along when we age, when we age, the epithelial cells within the lens, they stop producing this collagen fibers. Okay, because of this malproduction or no deficiency of the production of the new collagen fibers, the cornea, instead of being a transparent, goes opaque. Okay, the cells dies. Okay, and because of that the lens become opaque. It start becoming opacification is the right term which I need to use right here. So instead of transparency, it becomes opacification. Opacification start happening, and because of that, the light rays are not permitted through the lens to pass through. And because of this thing, the patient sees glare. First thing comes is the glare. He sees the glare whenever he sees the light illuminating thing or light focus, like headlights, vehicles headlights and all. So he'll be seeing a glare. Okay, he will be sensitive towards light. Pain will be there within the eye. Okay, so all this kind of thing will be there, and even he will eventually lose the vision when the cataract is completely developed and it gets completely matured, and the more the light can pass through the lens, at that time he loses the vision. So blurry vision. After the blurry vision, he comes with the blindness if it is not treated. So why the cataract could be caused? One thing is the age. Age is a major factor. After aging occurs, the cataract, the lens cells stop producing the collagen. New repairing of the cells doesn't happen. Okay, and because of that thing, the cataract can leave. Next thing is the irreversible injuries. Any trauma is there. Okay, at that time the cataract can happen to the lens, and even diabetic patients are more prone for the cataracts. Okay, in the age old they even get diabetes. the diabetes when it is not controlled, that time the person may get cataract. So cataract is the secondary cataract could be seen secondary as a secondary sign. It can be seen in diabetic patient. We'll be discussing with that thing. What is senile immature cataract? Again, senile nothing but the in the later stages. The senile immature cataract refers to development of the cataract, that is opacification of the lens in the old age as the age progresses. Okay, because of the decrease in the metabolism, decrease in the formation of the new cell, repair, growth has been declined, and because of this thing, a cataract develops, that is opacification of the lens circle, that is called as senile immature cataract. This is the second thing. Next comes is the congenital cataract. What is congenital cataract? Congenital cataract, wherein which the child himself he has because of some hereditary disorder, the cells isn't making proper collagen, or collagen disorder is there, and because of that thing, the lens isn't has a proper kind of transparency, or opacification is congenitally present. So that will be calling as congenital cataract. So how will you treat? By using again surgery, that is phacoemulsification, that we are going to discuss here. So next comes is complicated cataract. So what is a complicated cataract? So complicated cataract refers to a cataract that has occurred because of some other infection, or some other kind of another clinical manifestation present in that person. So some other clinical infestation, or some other diseases like iritis is there, he developing the cataract. Iridocyclitis is there, he is developing the cataract. Or retinitis is there, he is developing the cataract. Diabetes is there, the person is getting cataract. And even glaucoma is there, the patient is developing the cataract. So the cataract, that is the result of the other disease, other underlying diseases, it is called as complicated cataract. So again, how we will treat? Same the surgical treatment, that is the phacoemulsification. So I will be telling you this phacoemulsification here. So what next comes is the post-operative complication of cataract surgery. So the lens has become opaque. No more the light is getting onto the retina, and we are not getting the image. Okay, at that time what a doctor does? Doctor does the removal of the lens. No more the lens can be reversed to the transparency. One thing, cataract is an irreversible disease. It cannot be reversed. The degeneration that has happened within the lens cannot be reversed. So now what he does a removal of the lens. Okay, once after the removal of the lens, there is something called as post-operative cataract surgery complication. Post-operative cataract surgical complication could be seen. What are those? There may be bleeding in the choroid. Okay, there may be even edema of the cornea. There may be infection within the eye. Okay, or there may be under subconjunctival hemorrhage could be seen. Okay, this all or even the displacement of the newly placed lens. Okay, the lens implant can be displaced from one place to other place. There may be iridocyclitis could be seen. There may be glaucoma could be seen within the eye for nearly 8 weeks. If the diseases may occur because of the post-operative cataract surgery. Okay, this may be the manifestation that would be seen after surgery of a cataract. So next comes is what is hyphema. So hyphema again, it is the accumulation of the blood. It is the accumulation of the blood in the anterior chamber. So the eye has two chambers. First, behind the cornea, there is anterior chamber, and after the anterior chamber, there is an iris. Behind the iris, there is a lens. Okay, so the chamber, the space between the cornea and the iris is called as an anterior chamber, and the space between the lens and the retina, the entire back posterior part, it is called as posterior chamber, which is filled with the vitreous. Okay, so now what is an hyphema? Hyphema refers to the accumulation of the blood. Whenever there is iridocyclitis, inflammation of the iris, there is rushing of the blood from the blood vessels that are present in the choroid, okay, into the anterior chamber. Okay, whenever there is a blunt trauma to the cornea, blunt trauma to the iris, okay, during any sports or during even keratotomy, during a surgery, okay, at that time the rushing of the blood, very sensitive capillary, whenever they are damaged, the blood rushes and get accumulated or lodged within the anterior chamber, which has to be removed by draining. Okay, by small incision can be made, like keratotomy like incision can be made to drain that blood out, and then using antibiotics and anti-inflammatory to reduce the inflammation and stop the infection to occur further. Okay, so this will be about the hyphema. then again crystalline lens. As I told you before in the early part of this video, crystalline lens, it is a transparent lens, it is a normal lens, it is made up of outside it is made up of capsule, inside the second layer is the cortex, which is made up of it is lined by the epithelial cell, and inside that there will be a nucleus which is highly made up of or dense it is condensed with the crystalline or the transparent fibrinous material, collagen material. Okay, this is the only part of the lens. It is simple, it is elastic, okay, it is flexible, and it is transparent anatomical structure which is present within your eye that focuses light over the retina. Next comes to the phacoemulsification. What is the phacoemulsification now? The phacoemulsification refers to extracapsular extraction. What is this extracapsular? The lens is surrounded by capsule, tough membrane. Okay, within the capsule there is lens. Now what the doctor does whenever a cataract happens, okay, whenever the opacification happens, the doctor makes a small incision over the cornea. Then he passes a probe within that cornea that passes through the iris, okay, through the iris into the capsule and into the lens. Now after passing within this thing, when he touches the lens, he produces a high wave of ultrasound waves. Ultrasound waves are passed through that probe, and this causes the breaking of the lens. The lens get cracked and it breaks into small fragments. Now what he does? Now he aspires the broken down material or debris of the lens outside. So this is leaving the entire capsule intact. So this is called as phacoemulsification. It is the famous surgery that we use to treat the cataract, and it is well known as a cataract surgery for the cataract. Okay, phaco, it is named as phacoemulsification. Shortly it is termed as phaco. You have to remember this always. Why it is famously used? Because of the less incision, very small incision is there, occurrence of the infection is very less, occurrence of the edema is very less, choroidal hemorrhages are very less, subconjunctival hemorrhages are very less, and one day in, one day out. The patient can come for the one day and he can go at the same day to his home. Minimal incision, minimal innovation, okay, minimal rest is required for the patient. Okay, these are all the advantages why we use phacoemulsification. Mainly, instead of laser surgery, we use phacoemulsification to treat the cataract. Okay, to extract the cataracted lens or the opacified lens from the cataract. Now comes is the extracapsular cataract extraction. So this is what extracapsular capsular extraction. So capsule is intact and the lens is made out of the capsule. Extracapsular attraction, and this space is filled with a saline fluid. A saline fluid is filled and irrigated by the saline fluid, the anterior chamber. Okay, anterior chamber. This intracapsular space is maybe filled with even an artificial lens. It can be filled with the artificial lens once after the removal of the cataract affected lens. So if you keep the capsule intact, it is called an extracapsular extraction. If the capsule along with the capsule entirely it is removed, the lens is removed along with the capsule entirely, then it is called an intracapsular extraction, which is not at all practiced in today. Okay, because of the severe chances of infection, because they are instead for removing the entire cataracted lens along with the capsule, we need to make a larger incision over the cornea, and we have to incise even the iris. We have to remove the entire thing out, then stitches will be there. It is highly invasive, it is highly complicated, it may lead to higher complication than the infection, it may damage entirely the eye system. So we don't use capsular extraction of the lens anymore. So what we do only capsular attraction, in extracapsular extraction of the lens. So in this video we have discussed all these things which is provided in this chart. So at the end of this video I will be asking you some questions which you need to comment below down in the comment box and tell me what are the answer for this thing. So first question is, what is a cataract? Its definition, it causes, and how we will treat this thing. And the second is, what is senile immature cataract? The third is, what is a cortical cataract? Then the fifth is, what is a congenital cataract? What is a complicated cataract? What is complication in the postoperative cataract surgeries? What is an hyphema? Its definition, it causes its clinical feature and its treatment regimen. what is a crystalline lens, its parts, and what are the main parts that are affected in the different type of the cataract. Then comes with the what is phacoemulsification, then what is an extra capsular cataract extraction. So you need to answer all these questions. So you can see the chat, type it down in the comment box so that it will be a revision for you. So if you don't understand this concept within one time, please I request or suggest you to see this video at least 2 or 3 times so that you can understand precisely what is this lens and what is this cataract and what are the surgeries that are involved in this cataract. So I hope you enjoy my video. Please like and subscribe to my channel. Click the subscribe button down below, and thank you for watching. So please stay healthy, be happy and be calm.